Hi, my name is Erica, and I'm here at the Gastric Institute. I am about to get a fill. It's really quick, painless. I really never feel it. It's just like a quick little pinch, and this will help restrict me so that I can keep on losing weight. Hi, here I am inside the adjustment room waiting to get my next fill. Just checked in and got off the scale, and I am at 219, so I did gain 2 pounds, between 2 and 4 pounds from my last fill, but that's okay. You know, sometimes we go through those little changes, but I'm still 100 pounds down from surgery, so it's all a blessing for me. And now I just go ahead and get my fill. It takes less than 5 minutes once they come in. Take a sip of water to make sure you're feeling okay and can get it down nicely, and I'm off to work.
Hi, I'm Brian. I'm the physician assistant here at Gastric Institute, and Erica's here today for an adjustment, so I'm going to tell you how we do it. Okay, so the first thing we're going to do is just have Erica lay down. And I always like to start off by just feeling for her port, and that way we know exactly where we're going with the adjustment. We want this to be as easy as possible, so once I'm comfortable with where the port is, and we're just going to clean her skin off because we do this under sterile technique. And so we just use alcohol to do that. You haven't been having any pain or anything with your port? Everything's been going fine?
Everything's been going real good.
Perfect. Alright, so now I'm just going to get my gloves on. For Erica, we're going to do kind of a small adjustment today. This is just sterile water, and that's what we're going to put into the balloon. We use the sterile water, and that way if we're not in the actual port and we happen to inject this just into the subcutaneous tissue, it's not toxic or anything. Alright. So I'm just measuring how much I'm going to put in. And then I'm going to go back to where I found the port before, and I'm just going to feel for her port. Once I'm comfortable with the orientation, I'm just going to slide my fingers on either side of the port and then just aim the needle right for the middle of my fingers, and it should be right where the port is. So here's a little poke. Just like that. And then I always pull out just to make sure I'm in the port, and as you can see there's a little bit of fluid coming into the syringe right there, and that just confirms that I'm actually in the port. So once I'm comfortable that I'm in the port, I'm just going to inject the fluid back in, and then I just do one more confirmation and I pull some fluid back out. Again, that just confirms it's in the port. If the needle wasn't in the port and I injected that fluid in there, it would just go out into the tissue and I couldn't get any back. So this just confirms that I'm in the right spot. So I push it back in, pull the needle out, and we're done. That's it.
Quick and painless.
I'm just going to put a Band-Aid on there, and we're done. And then the last little step is just to have Erica sit up, take a drink of water to make sure it's not too tight, and that's it. You got your own water today, so.
Yes. It goes down fine.
No problem.
So that means I'm good to go.